got rectal bleeding.
What, all of you?
House MD was a medical drama that ran from 2004 to 2012. It follows our main character, Dr. Gregory House, played by Hugh Laurie, who is a genius, snarky doctor working at Princeton Plainsboro Teaching Hospital in the Diagnostic Medicine Department. It took direct inspiration from Sir Arthur Conan Doyle's Sherlock Holmes, with House having to solve a medical mystery each episode. Most episodes followed this episodic format, with each episode introducing a new patient with a new disease with a new cure. However, there were several narrative subplots that would run in tandem with these episodes. One of the major ones, a narrative parallel to Holmes' serial cocaine use, was House's dependence on Vicodin. It is one of the major plot points throughout the show, showing his progression through the drug, with him gaining tolerance, trying to get off the drug, hallucinating, and eventually going to rehab. Today, I am going to analyze House's opioid problem, its causes and effects, talk about how he tried to fix it, and how I think he should fix it, and the quality of the portrayal. House takes Vicodin, which is a semi-synthetic combination of hydrocodone and acetaminophen. Hydrocodone is the most frequently prescribed opiate in the US, which means House is taking opioids, along with copious amounts of Tylenol. He originally took Vicodin because of the severe muscle degeneration in his leg, which he decided not to get amputated, and caused him to break up with his fiancée at the time. Even though he may have started using opioids with reasonable intentions, he devolved into abusing them soon after. House meets the description in the DSM-5 of opioid use disorder. He has what the DSM describes as a problematic pattern of opioid use leading to clinically significant impairment or distress. He also met many of the other criteria the DSM requires, despite only needing to meet 2. His opioids were taken in larger amounts than intended. There were unsuccessful efforts to control his opioid use. He had cravings to use opioids. He continued to use opioids despite knowledge of having a recurrent problem that was likely exacerbated by his substance. He also developed tolerance. Let's quickly go over some of House's craziest escapades regarding his opioid use. Warning, spoilers if you haven't watched the show yet. On Season 1, Episode 11, to win a bet for a month off clinic duty, House decides to get off Vicodin for a week. He goes through intense withdrawal symptoms and barely makes it through the week, with excruciating pain. On Season 2, Episode 13, House says he is experiencing extreme pain in his leg and begs for his boss, Dr. Cuddy, to give him morphine. She ends up pretending she gave it to him, but only gave him saline. He thinks it works. This points to the fact that his pain may be psychological. Between the beginning of Season 3 and the end of Season 2, House gets an experimental ketamine treatment to help his leg, which works and he stops taking Vicodin, but the effects quickly fade off. Once again, this might be a pointer to his pain being more psychological, with the healed leg being a temporary fix to get him off the meds, but his lack of a true support group making him relapse. In Season 3, Episode 16, House has problems urinating, claimed to be due to his Vicodin. Between the beginning of Season 6 and Season 5, House has a sexual encounter with Dr. Cuddy, which unbeknownst to him was fully hallucinated. This led to House to go to a psychiatric hospital. He now has a therapist and is off Vicodin. Season 6, Episode 20 is the last episode we get to see House's therapist. In Season 6, Episode 16, House goes through a tough breakup with Cuddy, goes back on Vicodin, and stops talking to his therapist. In Season 7, Episode 21 and 22, House takes an experimental drug, which hasn't even entered human trials, to restore muscle in his leg, but it ends up causing tumors, so he performs surgery on himself in a bathtub. In the Season 7 finale, House drives a car into Dr. Cuddy's house while high on Vicodin, and probably other stuff too. In the Season 8 finale, House fakes his own death because his friend is dying and he doesn't want to go back to prison. As I stated before, House first started using Vicodin for his leg pain after having surgery for it. We learned this in Season 1, Episode 21. He became bitter about losing his leg because he believed he could have done a better job than his doctors. During this time, his fiancée left him. He continued to use Vicodin, building tolerance and increasing doses.
Very simple equation. More pain, more pills.
His friends, who were doctors, were enabling him by writing him prescriptions, which they justified because he was saving patients. But all this doesn't paint a full picture of how Dr. Gregory House ended up with opioid use disorder. I think the problem is rooted deep within humanistic psychology principles and reinforced by classical conditioning. First, let's speak about the humanistic theory applications here. House does not have all his pyramid of needs met. He is up to safety, but he does not have love nor belonging. He has friends who love him, coworkers who respect him, but he is unable to see it, leading his interactions with those people to be shallow. Individuals who have a stronger social support group with families adopt substance use disorders less frequently. His father was neglectful and abusive, not giving House an unconditional positive regard, something which is very important to childhood according to humanistic theory. Also, individuals who have substance use disorders often have a range of abusive early experiences in childhood. House has a deep resentment from the loss of his leg and has an ideal self of a man who still has a working leg, who is still in a relationship with Stacy, which causes an incongruence with his real self, the addict with a bum leg. This incongruence led him to developing and keeping his opioid use disorder. Like with most substance use disorders, House's opioid use disorder also has elements of classical conditioning. House experiences positive reinforcement when he is on Vicodin by being high, and negative reinforcement because his pain goes away. This leads his brain to want to take Vicodin all the time, especially if he feels pain. Ergo, House's opioid use disorder is reinforced by classical conditioning. It also doesn't help that House has a very impulsive personality, which is a central characteristic of developing a substance use disorder. At the beginning of Season 6, House got treatment for his opioid use disorder at a psychiatric hospital. First, they took him off his meds by reducing the dose of his opioids in a controlled environment, after which he was free to leave. However, instead of leaving, he decided to stay, mostly to get a letter of recommendation so he could get his medical license reinstated. After causing some mischief,
Thank you, Greg.
he eventually learns to trust his psychiatrist, and they start interpersonal therapy based on learning to create and maintain meaningful relationships. I think this form of therapy was very important because it was one of the main factors that led to his overuse in the first place. They also gave him some SSRIs. After his psychiatrist progressed in House's ability to create relationships, he let him leave the psychiatric unit. These skills helped keep him sober for a while, but once he encountered his next major stressor, he got back on drugs. Now it's time for me to recommend treatment for House. There are 3 important things to note about Dr. House when considering treatment. He is cynical, lonely, and smart. And he thinks he's smart. That is why more shallow rewards like contingency management will be less effective toward treating his opioid use disorder. He has money. Something like a gift card will not be enough to keep him from using. A treatment he can clearly see through might lead to him disregarding us. We need a way to develop trust with him, either through credibility or through genuine care, preferably both. We need to create a support group so when he goes back and struggles through a hard time, he has someone to call to prevent a relapse. We need a system that is personal and he can't simply just think through. And preferably, we need something abstinence-based, since he will most likely find a way to abuse harm reduction treatments like methadone. Either way, these are all considerations we need to put into effect. All of this considered, I think the best treatment for House would be a 12-step program with cognitive behavioral therapy elements. First, it would be best to establish trust with House, hopefully not in a psychiatric unit full of vulnerable people that House could exploit. Seriously, what were they thinking? One way I could do this is to reach out to his friends and colleagues if it wouldn't break the barrier of trust between him and I. We'd challenge his thoughts and try to restructure them into something better. We'd do this using cognitive behavioral therapy, which works with people to challenge distorted thoughts and practice new approaches out in the real world. House is someone who doesn't often open up, so understanding the thought process behind him taking Vicodin would be important in getting him to cut back and stop. I think the most important thing for us to look into would be his emotional reasoning, making sure he knows people care about whether or not he's taking Vicodin. And then we'd make sure his thinking isn't black or white, so we can't just shrug off Vicodin as for his leg. We'd probably have to start with simple talk therapy, since House would not want to do homework. Then we would start a 12-step program. These are peer-based self-communities like Alcoholics Anonymous. House could go with the desire to stop using and find other people with similar experiences and tips. He needs a support group besides just him and I, and what better than a group of people in the same situation as him? He could find a sponsor to help coach him and keep him sober. He could find a community, something that he desperately needs. The message of the group, God give me the strength to accept the things I cannot change, courage to change the things I can, and the wisdom to know the difference, is a message House desperately needs to hear, and was touched on when he was in the psychiatric hospital. This would be my plan to get House off Vicodin, and I think he would need it. Considering this poll I found on Reddit, other people's expectations for him are not high. Finally, let's talk about how House's opioid use was portrayed. Overall, I thought it was a very good portrayal of the disease, based on what I've read and learned in my psychology class. It is not easy for him to get off of opioids. His problems aren't fixed when he gets off, and they don't downplay the withdrawal. This is surprising since this show has a history of medical inaccuracies, with some offensive portrayals of certain diseases. Most of the portrayals of mental health in this show could be more accurately done, but they did a good job with Dr. House himself. Hugh Laurie even reportedly took Vicodin to prepare for this role, which is crazy. If I could change one thing, I would better show the health consequences of overusing opioids. Other than showing that he was having trouble urinating, House had very few negative physical consequences from taking Vicodin. Though he did have several psychological complications, the physical ones, like visual acuity impairment, dry mouth and nose, and severe constipation, were never shown in the show, and they could have been a good visual indicator of House's suffering with the disorder. However, there is one problem my mom pointed out that has stuck with me the entire time I've watched the show. House is taking an opioid mixed with acetaminophen. He would have overdosed on Tylenol before the 3rd season. Why did they pick Vicodin instead of hydrocodone or something more realistic? Why Vicodin, the specific opioid with Tylenol? Why not like oxycodone? That's a stronger opioid. Why would he be on Vicodin? Why Tylenol? Tylenol doesn't make any sense. It's like he's drinking cough syrup instead of freaking alcohol. I don't get it. Why is... Thank you all for listening to my presentation. I hope you've enjoyed listening to me talk about one of my favorite shows of all time. I hope if there's one thing we can all learn from House, it's to have people around you that you can count on. Going through life alone is doable, but difficult, and it's always good to not be afraid to ask for help when you need it, or listen to someone who's trying to help you. But maybe you shouldn't listen to my advice, because as House always says,
everybody lies.